Hello everyone, welcome to my channel RaviAestheticPhysio. So the one topic, anticholinergic drug. So it is a part of pharmacology which is came in our university examination. So how you can write university examination for the good marks. So let's understand what is anticholinergic drug. So its work opposite to the anticholinergic drug, cholinergic drug. So these are drugs which occupy the acetylcholine receptor and do not allow acetylcholine to bind the receptor. It means what is the action of cholinergic drug? It is the same to the acetylcholine. It is the binding action and the show response of the fear and flight and brown bladder movement, pupil construction, dilation, sweating, and different kind of GI activity in body, and sympathetic or parasympathetic. But the anticholinergic drug we are using on that of the time, the acetylcholine release continuously and do not stop. So over sweating, over pupil dilation, over GI motility, and also if hyperactivity, and if the same time if that kind of activity happening in our body, so we were taking anticholinergic drug to stop and prevent the activity of that acetylcholine, so that bind to the acetylcholine of the target receptor, so stop the producing different kind of hormonal activity of the acetylcholine or different activity of the body. So let's understand. So anticholinergic drugs are also called parasympathetic, anti-parasympathetic agent, cholinergic blocking agent, and cholinergic antagonist. So all of these are the name of anticholinergic drug because it opposite action of the cholinergic drug. So next is to be classification of anticholinergic drugs. So anti-muscarinic agent and anti-nicotinic agent. So these two are the also part of the cholinergic drug, but the anti word is added because their action is to be opposite of that. So the anti-muscarinic agent is to be atropine and troposinamide. So these two medicine are taken on that time. So if the hyperactivity of the body will be performed. So anti-muscarinic agent, that anticholinergic drug that blocks the action of acetylcholine on muscarinic receptor, are called anti-muscarinic agent. Example, atropine. So atropine is the alkaloid and blocks that all the type of muscarinic receptors. So now studied what kind of activity anti-muscarinic agent or atropine medicine is to be stopped in our body. So the pharmacological action, what will be happen after you have taken atropine medicine? So in the CNS levels, central nervous system, mild stimulation. If patient have a hyperactivity in central nervous system, so if atropine medicine it will be taken. So the hyperactivation of the central nervous system, it converted to mild stimulation. I mydriasis, CVS cardiovascular sensor, it causes the bradycardia initially and tachycardia. So first is to be bradycardia and next is to be tachycardia. Respiratory system is to be bronchodilation. It means previously you have to send that the bronchoconstriction will be occur, and after you have taken the medicine, so it will be convert into the bronchodilation. Secretion of the sweat and saliva and gastric are reduced. It means that before the taking of the medicine, what will be happen? The overactivity of the saliva, overactivity of the perspiration of the sweat gland, and overactivity of the gastric juices will be secreted and happening in our body. But after you have taken the anti-muscarinic agent, which is atropine, there is all of the action is to be reduced in our body. And GIT, gastrointestinal tract relaxation, decrease peristaltic movement. So it used as an anti-spasmodic and anti-diarrheal agent. So if hyperactivity of GI tract, so it will be reduce the GI activity in our body. Next is to be indication, which time the patient have to be taken anti-muscarinic agent. So the for dilation of the pupil, before the taken of the medicine, there is to be constriction of the pupil. If you are taking the medicine, there is a dilation of the pupil of the occur on that time. Pre-anesthetic. So if patient have before the any kind of surgery, so we are taking anti-muscarinic agent. In bronchial asthma and COPD. So in COPD and asthma patient, we have taken the anti-muscarinic agent. In hypersalivation, if patient have too much saliva in their mouth, so we have taken the atropine and tropomycin medicine for the reduce them activity of the salivation and the treat in the diarrhea. If the patient have suffering from diarrhea and for the long period, so we have taken the atropine medicine or anti-muscarinic agent for that patient. Dose is to be it given the intravenous route, intramuscular route, or subcutaneous route for 0.4 to 0.6 mg for prospective and pre-anesthetic 1% solution in eye drop for myodiarrheas. So Why intravenous and why intramuscular route? Because it will be directly give to the reach out to the systemic circulation and find it out the target organ easily. And if there is if a patient is to be get taken the medicine by oral route, so there is a chance to like dissolve into the mouth, and the first pass metabolism to dissolve into the liver, and the activity of the medicine is to be reduced. So the intravenous, intramuscular, and subcutaneous route is to be very benefited for the patient who have been that kind of situation of the suffering, and there is beneficial for them. And contraindication: in glaucoma condition, in infant suffering from Down syndrome, delayed development of the body and brain, in patients are hypersensitive with atropine. So in glaucoma condition, so if patient is taking that kind of non-muscarinic and anti-muscarinic drugs, which is atropine, there is chance to be glaucoma increased. And in infant is suffering from Down syndrome, so the development of their brain is to be now more delayed. So don't take the atropine medicine of those time. Next is to be in the patient of hypersensitivity of atropine. The atropine medicine is to be higher, like sensitive of the some patient, so it not be taken by mouth or orally, so it inappropriate. So some most of the time we are taking the intravenous route. And the hypersensitive patient, which is like taking so the rashes or like irritation, GI irritation, or like blood different kind of disorder, so we are not giving that kind of medicine of those patients. So now the anticholinergic drug is to be done. And